Ethiopia's health sector is facing a significant crisis after the United States Agency for International Development, or USAID, announced the suspension of its development projects in the country. The decision, which is part of a broader Trump administration policy shift, has resulted in the termination of over 5,000 health worker contracts. The Ethiopian Ministry of Health has confirmed that it has received a directive to suspend all activities and payments funded by USAID and the Centers for Disease Control and Prevention, effective January 24, 2025. The decision will have a profound impact on Ethiopia's healthcare system, particularly in rural areas where USAID-funded programs have been providing essential services. Dr. Dereje Duguma, a state minister at the Ministry of Health, expressed concerns about the potential consequences of this decision. With over 5,000 health workers losing their jobs, there is a real risk of a disruption in essential health services, he said. Many of these workers have been on the front lines of the fight against HIV, AIDS, tuberculosis, and malaria for years. The Ethiopian government is now scrambling to find alternative funding sources to maintain essential health services. However, with limited resources, it may be difficult to fully replace the funding and expertise that USAID has provided. The Trump administration's decision to cut funding for foreign aid programs has been widely criticized by health experts and humanitarian organizations. Critics argue that these cuts will undermine global health efforts and have a disproportionate impact on developing countries like Ethiopia.